Dr. Kyle with Project Wellness Company. Low back and hips, tightness in the muscles in your glutes, your piriformis, your hip flexors, your hamstrings, all those things are going to play a huge piece into the functionality of our low back and whether or not we're having pain in our low back. And so some really good stretches that we can do at home, or I do specifically within the office to aid in the correction of the low back, is we're going to start with the hip flexors. So I'll have her slide her hip just to the outside of the table here. She drops this leg down, and when you drop this leg down, it's really good to bring that toe back and set it underneath, because that's going to get a full stretch on her entire anterior chain of muscles that we're addressing here. And then she goes ahead and bring this knee up, okay? And so I would apply some pressure into that knee here while pushing down on that other side, allowing that hip flexor to stretch. Now the area that she's going to feel that pulling in is going to be right up here where those hip flexors are attaching onto the leg itself. And so when she brings that knee up, we're just going to hold that stretch, okay, for at least 30 seconds to get a really good stretch out of that hip flexor. And ultimately what that's going to do is that's going to free up mobility in the front side of that hip, so that way when we're started addressing and adjusting that low back, it's going to get that to relax more and allow the adjustments to be way more successful. Now off of this one, the next one that we do right away is we're going to do a Piriformis Stretch. Okay, so she'll stay in the same position she's at. Difference is I'm going to bring this knee up, okay, and I'm going to grab her ankle here and rotate that across her body. So once I have this kind of in position, her knee is going to be about right underneath of her nose, or right in the middle of her chest here, and then this ankle is where all my tension is going to come out of. So I'm going to apply some pressure up to get her knee to the middle of her body here, and then we're going to rotate, and she's going to start to notice that tighten up really pretty quickly. And once again, we're going to be holding this one for 30 seconds. Now if she was doing this one at home, the same knee that comes up, she's going to put that hand on the back side of the knee, and then she reaches up to her ankle here, and she holds that position herself. And so if she's doing it correctly, she's going to feel a pull on the outside of the hip. So on this side, she's going to feel that pull right in through here. Now the one common mistake that we see is people will put this more towards their armpit and then rotate. And so what that does is that's going to allow us not to get the same stretch as it coming across the body to the midline and adding that rotation in. Once again, we're going to do 30 seconds on this one in order to get that good stretch, and then we'll transition to our last one that we like to do, which is our hamstring stretch. So this one, that knee is going to come straight. Okay, I like to block her other leg, which essentially will hold her pelvis to the table here. So bringing my knee up to hold that outside leg up, keeping this knee straight and the toes in a downward flexion. What we want to do is we want to slowly bring that knee up. Okay, bring that leg up, and you're going to feel that tension come in there pretty quickly. And so what we want to do is once we get to that tension point, we just want to hold it. And so we could hold this for 30 seconds, or we could do a little P&F stretching. And so how we would accomplish that is I'm going to instruct her, what I want her to do is try to push her heel to the table. And as she's doing that, what I'm going to do is I'm going to hold it in this position. And when I tell her to relax, it's going to essentially trick her muscles into allowing me to get further in her stretch. So go ahead and push down as hard as you can, and then relax. And you'll notice how much farther we're able to get out of that stretch. Now typically I only do the P&F 2 or 3 times, because eventually we're going to get all the stretch that we can out of that. So I'll have her engage again, push down as hard as she can, and then she relaxes. And you'll notice how much farther we're able to actually get that muscle to go and to stretch, which ultimately the hamstrings that we're stretching right now are attaching to the hips. And so by loosening that up, it's going to allow our low back adjustments to be more successful and allow us to better correct and address the imbalances that we find within the spine through our examination and what we're doing to work on those specific goals for the patient.